Hello, I am Dr. Pamela Love, board-certified pediatric emergency medicine physician. I am also member and the vice president of the T. Leroy Jefferson Medical Society. The T. Leroy Jefferson Medical Society is a volunteer organization comprised of physicians and some non-physician members. Our mission is to serve the underserved through providing education, mentorship, and direct patient services. One of the things that we're most proud of is our annual health fair, where the members come together and volunteer their time to provide physical exams for children and adults. We are usually able to provide services to hundreds and hundreds of children and adults. I am originally from New Jersey. I went to grammar school in Upper Montclair and high school also in Upper Montclair. I went to college at the Johns Hopkins University, and during that time I discovered an interest in public health and pursued my master's in public health also at Johns Hopkins in Baltimore. Following that period of time, I worked in public health as a healthcare administrator, and I ran an emergency department, always knowing that I wanted to go back to medical school. And that I did. I went to Robert Wood Johnson Medical School and then went on to my residency at Yale University, College of Medicine. And during that time at Yale, I discovered that I loved all things related to pediatric emergency medicine and went on to get my fellowship in my subspecialty field, pediatric emergency medicine. So I have both board certifications in pediatrics and in pediatric emergency medicine. I love pediatric emergency medicine. Actually, I work in a trauma center where we see up to 90,000 patients a year. It's a busy field, and it allows me to treat everything from coughs and runny noses and fevers to gunshot wounds and cardiac arrests. I feel very privileged to have this career because I'm able to help children and families at some of the most critical and serious and stressful times in their lives. So it's not only exciting, but it's also humbling, and it's very much a privilege for me. A typical day in the trauma center can be very exciting. It can be a little slow at times. It can be very fast-paced at times. For me, the reason why I enjoy emergency medicine is because you never know what's going to come through the doors at any given time. So I could walk in and see a patient with a cut on their hand who needs to have stitches or sutures, or I could walk in and see a child with a fever, or I could walk into a major trauma where there are multiple people involved and have to take care of all of them. So I like that aspect of emergency medicine, being able to treat all kinds of things and also being able to continuously learn how to take care of all different kinds of things. You have to really be on your toes. For as long as I can remember, I've wanted to be a doctor. One of my earliest role models in medicine was a pediatrician by the name of Dr. T. Barry Brazelton. He had a show on television called What Every Baby Knows, and I remember being a small child and watching him and thinking, wow, I really enjoy watching, and I was pretty impressed by the way that he gave advice to his parents, the parents on the show, and also gave advice to the viewers. And I thought to myself, I want to do that. So while some of my friends were watching Sesame Street, I was watching What Every Baby Knows, and that's what led me to pediatrics. When I'm away from the emergency department, I enjoy volunteering in many different organizations, including the T. Leroy Jefferson Medical Society. That is one of quite a few that I'm active with. I also enjoy spending time with my family and my friends. I love to travel. I love fashion and shopping, music, and dance. pieces of advice that I would give to a young person interested in entering the field of medicine, number one would be to realize that the possibilities are endless. You could work in a lab behind the scenes, working on treatments and cures for different diseases. You could work as an administrator in charge of an entire department, say in a hospital or a hospital-related business. Or you could work directly on the front lines, in the operating rooms, in the emergency departments, in the patient offices. There are many, many, many different ways to pursue your interests in medicine. Secondly, I would say to set your goals and stick to them. Make sure that you find people who support your ideas and do away with the people who don't. Don't bother with those guys. Lastly, I would say to stay true to yourself. If you love sports, you can still be the captain of the basketball team and love medicine. If you are an art major, you can still go to medical school. All of these things can be done with proper preparation. So take the courses you need to take, but also take the time to pursue all of the things that you enjoy.